Hi, I am Dr. Arjun. I am a specialist oral and maxillofacial surgeon. I work with NMC Medical Center, Sharjah and Sharjah. Coming to the temporomandibular joint. The temporomandibular joint are two in number. It's there in your jaw and it helps you to eat, to talk, to even yawn at some times. So this joint, if you look at the anatomy, any joint in the body which is weight bearing in nature has two bones which are touching each other, but to prevent them from abrading each other you always have something called a disc. A disc is, you can think of it like a rubber or a shock absorber between the two bones. Now in the temporomandibular joint, it's a load bearing joint because when you eat food there is significant load that goes to your cranium. So sometimes because of various factors which I will be explaining next, what happens eventually is the disc in between those two bones is going to slightly slide out, and that is called as anterior displacement. So this anterior displacement of the disc creates an abnormal anatomy where a part of the disc gets entrapped between the two bones. Let's make it simple. Let's say you are eating a burger. When you bite on one side, sometimes you must have seen the cheese coming out from the opposite side. So that's how it works. You have the joint and you have the disc coming out slightly from the opposite side. So this creates a scenario where you are trying to open the mouth to the fullest, the disc which is half inside half outside creates an obstruction, and when you slightly open it more, it slides inside and creates the clicking sound. Now why does the disc sometimes slip slightly outside? Now as I told you, I will be covering the factors which cause this. One of the common factors, as you see, we have something called symmetry in our jaws. You have the left side, you have the right side. So we are supposed to bite basically on both these sides. Now for other reasons such as loss of teeth on one side or because of filling on your teeth on one side which is slightly painful, you might always have a preferential side where you always have your favorite side where you chew your food. Now eventually over a period of 10 years, 15 years, when you start eating only from one side, you must realize that you are putting overbearing stress only on one joint whereas the other joint is being free. Now this over a period of time, let us say a decade or more, creates this disc to come out of the joint slightly, and this could be one of the factors. The second factor is called bruxism. That is when you sleep in the night for sometimes reasons unknown and in sometimes stress is known to be one of the cause, is you grind your teeth when you sleep. So when you keep grinding your teeth, what happens is the joint which is supposed to get rest in the night gets overactivated in the night, and one of the muscles called the lateral pterygoid, which has an insertion into the disc, kinds of pulls the disc slightly outwards. So this is again one of the factors. And the last factor would be trauma, where you have an impact on your jaw or on your chin and it creates a traumatic dislodgement of the disc, but the last one is the rare one. So now telling about all this must have got you worried, thinking that it's something that's serious. But if you grade this disorder or this problem, it can be graded into 4 types: 1, 2, 3 and 4. Now if it's an early lesion where it's just started with you and it's just been a few months or less than a year, and if it falls in the grade 1 or sometimes even 2, then getting something called a temporomandibular splint which you wear during the night can help you to almost reverse this issue. One more thing is, if it's in the grade 3 or 4 and also if there is significant distortion of the joint anatomy, it might need further reviews and investigations and also surgical intervention. So one of the ways we are doing this video is to raise awareness of those who have this early lesion to come in and try to prevent it from getting aggravated. Also stopping those factors which start the whole thing in the first place is also one of the solutions. For example, if you have lost a teeth on one side, replacing it as early as possible also prevents jaw disorders in the long term.